is Bell's palsy and इसको यूनानी में लकवा भी कहते हैं. So Bell's palsy is actually an acute unilateral facial nerve palsy. So the facial nerve, that is the cranial nerve number 7. So there is going to be damage to this nerve which causes unilateral nerve palsy. That is like only one side is affected. If you take the face, only one side of the face is going to be affected. So that is Bell's palsy. And then an anatomist known as Charles Bell, he only invented this disease. He found it. He found and named the disease after him, which is Bell's palsy. And then it can occur in any age. So anyone is predisposable. Anyone is at risk. So how is it caused? So the causes are, it is usually idiopathic. Like it is generally out of an unknown origin, and but sometimes it can develop abruptly 2 weeks after viral infection. So it can be of viral in origin after the patient has had viral infection for like 2 weeks or more. Like it can be a viral cold, it can be anything. So after that he can develop Bell's palsy. So the viruses such as Epstein-Barr virus, it is the most common virus causing Bell's palsy. And then you have herpes simplex virus, HIV, mumps, etc. Next one is exposure to cold. So cold can, as even in Unani concept, we know that cold causes weakness in the nerves. So exposure to cold can cause Bell's palsy, and then head injury can also cause Bell's palsy, and then diabetes mellitus is also in cause for Bell's palsy. And then suppurative otitis media. So as you know, the otitis media, that is ear, it is like pretty close to the brain, to the nerves, and therefore it is very easily, it can also affect the cranial nerve number 7, facial nerve, and it can cause Bell's palsy. And then GB syndrome, that is the Guillain-Barré syndrome, that can also lead to Bell's palsy. So these are the causes of Bell's palsy. Next we have clinical features. So what are the clinical features of Bell's palsy? How does a person with Bell's palsy actually look? So first we'll see, it is usually sudden in onset. So it does not come like gradually, does not start. It suddenly occurs. So there will be a deviation of one side of the face to the opposite side. So the face which is affected is usually deviated from the other side, and then there is going to be drooling at the angle of the mouth, the affected side. So there is going to be drooling, which means the salivation, you cannot swallow in the affected side. So if the patient's as you can see, this is the patient's left side. If the left side is actually affected, the patient cannot swallow in that side, so there will be drooling of the saliva, and then there is going to be drooping eyelids. So inability to close the eyes. So since the right side is affected, the patient won't be able to close his mouth or close his eyes, and then on attempting closure, the eyeballs turn upwards and outwards. This is Bell's phenomenon. That is when the patient who is having Bell's palsy, he tries to close his eyes. So the eyes, it will go like upwards, it will turn upwards and then outwards. So that is called Bell's phenomenon. And then there is going to be loss of nasolabial fold. As you know that every person has nasolabial fold on either sides of the nose, and nose and your labia is your lips. So between your nose and the lips there is a fold, a kind of a wrinkle. So in the affected side, the patient will lose his nasolabial fold, and then it does not reappear even after getting all right, even after Bell's palsy is cured. The patient will still have lack of nasolabial fold, and then there is going to be weakness on the affected side, and then there is going to be dryness of the eye. Why dryness of the eye? Is because the patient won't able to be able to close the eyelid on the affected side, and therefore the eyes will remain open on the affected side. So that will cause dryness of the eye, and whistling is not possible. So wherever, since the patient won't be able to blow the cheek because there is weakness in one side of the face, so to whistle you need to blow your cheeks, and then you have to have coordination of both the cheeks and lips. So that is not possible in a patient with Bell's palsy. So this is also like a clinical test. You can ask the patient when you're doubting the patient is having Bell's palsy, whether it's a child or an adult, you can first ask them to blow their cheeks. So the patient won't be able to blow their cheeks on the affected side. And then there is going to be loss of taste in the anterior two-thirds of the tongue, and there is going to be difficulty in drinking and eating. Yes, it is going to be difficult in drinking and eating because one side is actually not working. There is paralysis of one side of the face, so it will be difficult to swallow saliva on the affected side. So that's why we are going to face dribbling of saliva, and even drinking and eating, it's all going to be hard. So diagnosis, how do you diagnose Bell's palsy? That is through nerve conduction test. One, you can actually diagnose it like visually itself when the patient comes. Like clinically, you can diagnose with all these points that I said before. But if you want a confirmed diagnosis, then you can conduct a nerve conduction test, and then the myelogram. So that is your muscle conduction test. Myelogram can also be done, and then treatment. So how do you treat Bell's palsy? So treatment of Bell's palsy, it's just symptomatic treatment. You are going to give ocular lubricants because eye is going to remain open for a while, so therefore you need a lubricant. And then you are going to give low dose steroids. These are like only management. So you are going to give low dose steroids like prednisolone, and then you are going to do physiotherapy. So in physiotherapy you have nerve stimulation, so you can stimulate your facial nerve, and that will help a lot. So you are going to do physiotherapy. So this is like Bell's palsy. Before that, let me show you. So this is facial paralysis in Bell's palsy. So as you can see in the picture, so the left side of this person, he has Bell's palsy. So there is inability to wrinkle brow. That is, all of us can, when we wrinkle our forehead, like when you give pressure on your brows upwards, so the wrinkles will form. But in the case of Bell's palsy, you are unable to wrinkle it. And then there is again inability to close the eyelid. There is going to be drooping eye, asymmetrical face, and then loss of nasolabial fold, and then drooping of the mouth, and asymmetrical smile. So this is how a person with Bell's palsy will actually look like. So now that we are done, we are going to see Unani treatment. So यूनानी में वी गिव हब्बे जुद्वार. हब्बे जुद्वार जुद्वार ये मुखवी आसाब होता है, इसलिए यू गिव हब्बे जुद्वार. एंड हब्बे जुद्वार मोहरा कैन ऑल्सो बी गिवन. खमीरा रेशम हकीम अरशद वाला हब्बे नोखरा अरखे लहसुन के साथ आप जिमात कर सकते हैं, और कपरोटी कर सकते हैं. कपरोटी इलाज भी तदबीर का एक होता है, तो आप कपरोटी कर सकते हैं. तो ये तमाम चीज़ों बेल्स पालसी में कर सकते हैं. आप हब्बे अज़ारा की भी दे सकते हैं. अज़ारा की एक मुखवी आसाब होता है. सो यू कैन गिव हब्बे अज़ारा की, हब्बे जुद्वार या जुद्वार मोहरा, और हब्बे नुकरार के लहसुन के साथ जिमात करना, कपरोटी करना. ये तमाम चीज़ें आप बेल्स पालसी में दे सकते हैं. ये एक बारिद अमराज होता है. तो ये बारिद अमराज होने की वजह से ऑल टाइप्स ऑफ हार अद्विया दिया जाता है.